Most men with prostate cancer follow the exact same pattern. They notice something small, getting up once or twice at night to urinate, a slightly weaker stream than before, a sense that the bladder never fully empties, each thing explained away. Too much fluid before bed, getting older, stress, not enough sleep. Months pass, sometimes years. The symptoms gradually intensify. By the time a diagnosis comes, the window for the simplest, most effective treatment has already narrowed or closed entirely. That is not bad luck. That is what happens when the body sends a signal in a language most men have never been taught to read. Prostate cancer is the most common cancer diagnosis among men in the United States, accounting for 30% of male cancers, and is the second leading cancer death in men behind lung cancer. And here's the number that should stop you cold. The 5-year survival rate approaches 100% for early-stage prostate cancer. For distant-stage metastatic disease, it drops to only 38%. That gap is not biology. That gap is timing. And timing starts with knowing what to look for. This video covers the specific warning signs of prostate cancer, why most men miss them, who carries the highest risk, and exactly what tests to ask for. Not to create fear, to give you the information that makes early action possible. If this kind of clear, evidence-based health content is useful to you, subscribe and hit like. The goal is 200,000 subscribers, and you are part of making that happen. Chapter 1: What the prostate is and why symptoms are so easy to miss. Before the warning signs, you need to understand the anatomy because the location of this gland explains everything. The prostate is a small walnut-sized gland located just below the bladder in men. It wraps directly around the urethra, the tube that carries urine from the bladder out of the body. It produces the fluid that carries and nourishes sperm. It is also directly involved in the mechanism of ejaculation. Now think about that anatomical position, a gland that surrounds the urethra, sitting directly below the bladder. When that gland begins to enlarge, whether from benign growth or malignant tumor, the first things affected are urination and bladder function. This is why the earliest symptoms of prostate cancer so closely mimic something far more common: benign prostatic hyperplasia, or BPH, simple non-cancerous prostate enlargement that affects the majority of men over 50. The symptoms overlap almost completely, and that overlap is precisely why prostate cancer symptoms get dismissed for so long. Early prostate cancer usually causes no symptoms. While not common, symptoms of early prostate cancer might include problems urinating, including a slow or weak urinary stream or the need to urinate more often, especially at night. The absence of early symptoms combined with the overlap with benign conditions is the core diagnostic challenge. The solution is not to assume every urinary symptom is cancer. The solution is to know the specific patterns that warrant investigation, and then actually investigate them. Chapter 2: The 7 warning signs. What the research shows. Warning sign 1: frequent urination, especially at night. The enlarged prostate pressing against the urethra often leads to increased nighttime urination. Many men dismiss this as normal aging, but frequent disruption of sleep for bathroom visits deserves medical attention. The clinical term is nocturia, waking 2 or more times per night to urinate. One night, explainable. A consistent pattern across weeks and months, that is a signal. During the day, frequency also increases. The sensation of urgency, needing to urinate quickly once the urge arrives, is another component. The bladder never feels fully empty after voiding. That feeling of incomplete emptying is a direct consequence of the prostate partially obstructing outflow. Most men attribute this entirely to age or hydration habits. A father was diagnosed with prostate cancer after chalking his nightly bathroom trips up to drinking too much fluid before bed. He wrote off the early warning signs, until he received a shocking diagnosis. If you are waking more than once per night to urinate, and this has been consistent for more than 3 to 4 weeks, that warrants a conversation with your doctor and a PSA test. Warning sign 2: weak or interrupted urine stream. When the prostate enlarges, it can block the urethra, making it difficult to begin urinating or maintain a steady flow. Starting and stopping become a struggle. The stream that was once strong and continuous becomes weak and hesitant. It takes longer to start. It stops and starts mid-flow. Post-void dribbling, leaking after finishing, becomes common. Other possible early signs of prostate cancer include unusually weak urine flow and unexplained pain around the prostate while sitting. This symptom pattern is the one men most frequently normalize as aging. And while prostate enlargement does increase with age regardless of cancer, a new or progressively worsening change in urinary flow is never simply just getting older. It is an anatomical obstruction that warrants identification. Warning sign 3, blood in urine or semen. If your urine is pink or red, you should see a primary care doctor or urologist. This is a do not pass go moment. Even if there is no pain or it only happens one time, get evaluated to see what's going on if you have blood in your urine. Blood in the urine, called hematuria, or blood in the semen, called hematospermia, is one of the more alarming presentations of prostate pathology. It occurs when tumor growth or severe inflammation damages the delicate blood vessels running through the prostate and adjacent urinary tract. Advanced prostate cancer can cause problems with urination and blood in the urine or semen. The critical point here is the absence of pain. Many men notice a single episode of blood in urine, feel no pain, assume it resolved, and do nothing. A painless episode of blood in urine is not a reason to wait and see. It is a reason for same-week evaluation. Warning sign. 4. Pain or burning. During urination or ejaculation, the 5 most common warning signs include a burning sensation or pain during urination or ejaculation. A painful or burning sensation during urination or ejaculation is one of the 5 early signs of prostate cancer. This symptom is frequently attributed to a urinary tract infection or prostatitis, and those are far more common causes. But when burning or pain during urination or ejaculation persists beyond a standard antibiotic course, or when it occurs without any evidence of infection on testing, a prostate evaluation is warranted. Pain during ejaculation specifically, a symptom that many men find uncomfortable to report, is a clinically significant indicator of prostate pathology that should never be dismissed as simply muscular. Warning sign 5. Erectile dysfunction, the overlooked signal. This is the warning sign most men never connect to the prostate. Advanced prostate cancer can cause trouble getting an erection, erectile dysfunction or ED. The nerve bundles that control erection run directly alongside the prostate gland. As a tumor grows within the prostate, it can compress or infiltrate these nerve pathways. The result is progressive erectile dysfunction, not from psychological causes, not from cardiovascular disease, but from direct mechanical nerve impairment. The clinical picture that warrants prostate evaluation is erectile dysfunction that develops progressively alongside any urinary symptoms, particularly in a man over 50, with no prior cardiovascular risk factors to explain it. Erectile dysfunction alone has many causes. Erectile dysfunction appearing alongside urinary changes in a man over 50 is a combination that demands prostate assessment. Warning sign. 6. Bone pain, the advanced stage signal. Pain in the hips, back, spine, chest, ribs, or other areas from cancer that has spread to the bones is a sign of advanced prostate cancer. Prostate cancer has a strong tendency to metastasize, spread, to bone. The spine, hips, and ribs are the most common sites. When this occurs, bone pain becomes the presenting symptom. And in some men, this is actually the first symptom that brings them to a doctor. The pain is characteristically deep, aching, and constant, distinct from muscular or joint pain in its persistence and its failure to respond to rest or standard pain relief. It doesn't go away with movement or improve with heat application. Any deep, persistent, unexplained bone pain in a man over 50, particularly in the spine or hips, warrants urgent evaluation that includes prostate-specific testing alongside musculoskeletal investigation. Warning sign 7. Unexplained weight loss and fatigue. If the cancer has spread beyond the prostate, you might notice unexplained weight loss without dietary change, fatigue that does not respond to sleep, progressive physical weakness that is out of proportion to activity level. These are the systemic signals of advanced disease, the body's metabolic resources being consumed by a growing tumor burden. When these symptoms appear alongside any of the urinary, sexual, or pain signals already described, the combination is urgent. It indicates cancer that has moved beyond local containment. This is precisely why the earlier signals matter so much. If urinary changes, blood in urine, or erectile dysfunction prompt investigation early, the conversation never needs to reach weight loss and bone pain. Chapter 3. Who carries the highest risk? Not all men carry equal risk. These factors meaningfully elevate the probability. Age. Risk increases significantly after 50. The vast majority of diagnoses occur in men over 65. Race. Despite steep declines, mortality rates for prostate cancer are 2 times higher for Black men compared to white men, versus 67% higher incidence rates. Black men should begin screening conversations at age 45, not 50. Family history. A father or brother diagnosed with prostate cancer more than doubles personal risk. A family history of breast cancer, particularly BRCA2 mutations, also significantly elevates prostate cancer risk. Genetics. BRCA1, BRCA2, and Lynch syndrome genetic mutations are associated with higher grade, more aggressive prostate cancer. Diet and obesity. High saturated fat intake and chronic obesity are associated with elevated risk and more aggressive disease progression. Screening status. Only 38% of white men and 34% of Black men over 50 years old are being tested for PSA. The majority of men at risk are not being screened. If you are over 50 or over 45 with a family history or Black heritage, a PSA conversation with your doctor is not optional maintenance. It is appropriate medical care. Chapter 4. The PSA test, what it is and what it is not. The prostate-specific antigen test, PSA, is a simple blood test that measures a protein produced by the prostate gland. Elevated PSA does not confirm cancer. Benign prostatic enlargement, prostatitis, and even vigorous physical activity can elevate PSA, but elevated PSA in the right clinical context is a signal that warrants further investigation, typically a multiparametric MRI and potentially a biopsy. Normal PSA is generally considered below 4.0 nanograms per milliliter, though this threshold shifts with age, and some clinicians use age-adjusted reference ranges. The 5-year survival rate for prostate cancer has risen from 68% in 1,975 to 97% currently, and the prostate cancer death rate in 2022 was 52% lower than in 1,993. That progress is largely attributable to PSA screening enabling earlier detection. Ask your doctor specifically. I would like to discuss PSA screening and whether it is appropriate for me given my age and risk factors. That conversation is the single most impactful step a man over 50 can take. Chapter 5. Full warning sign summary. Here is everything laid out clearly for reference. Frequent urination, especially at night. Waking 2 or more times consistently. Urgency. Incomplete emptying. Persistent for more than 3 to 4 weeks. Discuss with your doctor and request PSA testing. Weak or interrupted urine stream. New or worsening hesitancy, reduced force, stop-start flow, post-void dribbling. Do not normalize as aging. Investigate the cause. Blood in urine or semen, even once, even without pain. Same week evaluation, no exceptions. Pain or burning during urination or ejaculation, especially if persistent beyond antibiotic treatment or occurring without infection on testing. Erectile dysfunction alongside urinary symptoms. Progressive erectile difficulty in a man over 50 with urinary changes warrants prostate assessment. Deep bone pain, spine, hips, ribs, persistent, aching, unresponsive to rest, urgent evaluation. Unexplained weight loss with fatigue, alongside any of the above, urgent. An estimated 83% of men are diagnosed with early-stage disease confined to the prostate or nearby structures, for which the 5-year relative survival rate approaches 100%. That favorable number exists because of screening, not because the symptoms are obvious, because men and their doctors looked before the disease moved. Everything here is for your information and education. Your health picture is individual, and the most important conversation you can have is with a clinician who knows your full history. How old are you? Leave your age in the comments. It helps shape what content comes next and tells me who is actually here. If this video gave you something real, subscribe and leave a like. That is how this channel reaches more people. 200,000 subscribers is the goal, and every person who subscribes moves it forward.